From our perspective with Cherry Health, we're
Yeah.
like working from the bottom up of like getting individual users and individual clinics online and onboarded and changing their processes around. But like from my perspective on that like ground swell route, it just seems like things would be so simple if we could just mandate everybody do the same thing all at once across a region or a province. Like, how does something possibly wind up taking so many years or decades to like do a new system or a new program, or like how does that even happen?
Yeah, I mean, I think getting to the point where somebody is willing to mandate it is tough, right? Changing leaders, changing priorities, changing government, changing fiscal situations. So if we look at Alberta, and I think it's safe to say like ConnectCare was a long project, but ultimately I think they were fairly successful in being able to do that for an entire province. That took a long time though, right? To get everybody on board and buy-in and implementation. But that's an example of if you stick to the priorities and say yes to things that align and no to things that don't, it can be done. It's hard to do that when there's so many competing priorities in the healthcare system. Like where is the right place to invest and put that money? And having spent time like in a similar situation when we were going out and selling EMRs to each doctor's office or each clinic, that can be painful, but at least they have a mandate to roll something out in their area. So from a startup side, that can definitely be harder because you're selling to thousands of customer, and ultimately the goal is like, can we get one big, whale of a customer that solves everything? I don't actually know if healthcare is set up that way, and I don't know if realistically we can do that just because of how our jurisdictions operate.
Well, I guess like anything that's going to extend beyond the 4 year, 5 year election cycle, now suddenly you got to have bipartisan buy in on things. You can't just count on one government wanting things to go through and their goals and
Yeah.
values being consistent a couple years later. The
Oh, for
funding
sure.
cycle, it gets complicated quickly, hey?